Hi, Bob Cook here, speaking about TA Supervision. If you're going to be a TA Supervisor, you will be talking a common language with your TA therapist. And I put up another slide of some of the concepts which will be covered and used by any TA therapist and supervisor. So we've got the concepts of ego states, transactions, script, strokes, contracts, and of course how the relationship occurs between therapist and the supervisor, and also therapist and client. Okay, so very briefly, concept of ego state, parent, adult, child, and here the supervisor will help the supervisee in looking at ego state diagnosis. In other words, looking at particularly how the client in the therapeutic sessions presents in terms of, is it more energy in the parent part of themselves, the child part of themselves, and of course usually it's about helping the client strengthen their adult up and what stops them doing that. So the supervisor will help the supervisee eke that out. Okay, transactions. Supervisor will help the supervisee stroke therapist look at transactional profiles, look at the amount of adult to adult transactions there are, and particularly look at what is called ulterior transactions and the unconscious communication that may stop people again coming from adult. Another concept here is the idea of script, and supervisors will help the therapist look out for unhealthy script patterns that the client may be presenting, and the therapist can explore with the supervisor how to facilitate the client in terms of treatment progress, which is usually about putting a new script on the road and integrating that in their life. Okay, another concept, contracts. Supervisor will be looking for contracts that are made between therapist and client, looking at if there's a behaviourable, achievable and observable part of the contracts, and looking particularly at how the client may sabotage the contracts being achieved in the therapeutic process, and if the therapist is aware of this whole process. So contracts are really important. In supervision there's adult to adult contracts for treatment planning, and then there's the admin, and there's the whole business of treatment contracts per se to look at in the supervision relationship and of course the therapy relationship. Strokes, another important concept in TA, how the client takes care of themselves. Do they give strokes to themselves? There's positive strokes and there's negative strokes, of course. Strokes are a unit of recognition, positive and negative, and a supervisor will help the therapist look at how the client culture of recognition is, not only in relationships but how they actually recognize themselves, and really sort of concentrate on how that fits into treatment planning, etc. And finally, we need to look at transference and counter-transference within the relational framework, and look at the transference between the therapist and the client. Now, as transference is an unaware process, and also counter-transference is outside someone's awareness, it really is important for the supervisor to help the therapist spot what might be going on in the unconscious process between the therapist and client. Now, to sort of stimulate transference, two good questions. One, who is the client in terms of the therapist, and who is the therapist for the client? That will take you straight into the transference process. Also, when we look at the relational framework, we need to also think of the transference between the supervisor and the supervisee and what's actually going on there, because at the end of the day, supervision is a professional discipline with its focus being adult to adult, not child to parent or parent to child. Okay, so those are some of the concepts TA therapists and TA supervisors will use, and hope this presentation has been useful for you. Thank you. Bye bye.